Placement of an intravenous catheter in a dog. Materials needed for this procedure include an 18 to 22 gauge over-the-needle intravenous catheter, a 3 to 12 milliliter syringe filled with saline, a T-port or solution administration set with chosen fluid, and 1-inch tape torn into 2.5 by 3-inch long pieces. One of these pieces should be split lengthwise so that you have 3 pieces total. Also, clippers with a number 40 blade, alcohol prep solution, and antiseptic prep solution. Intravenous catheters in the dog are routinely placed in the cephalic vein of the forelimb and the lateral saphenous vein of the hind limb. An assistant is required to restrain the dog and occlude the vein proximal to the point of catheter insertion so the vein can be visualized. If appropriate, the dog should be sedated 20 minutes prior to catheter placement to minimize the need for restraint. The site of catheter placement should be clipped with a number 40 clipper blade and disinfected. For short-term catheterization, cleaning with isopropyl alcohol is sufficient. If the catheter is to be left in place for more than 4 hours, a sterile prep should be used. The dog should be restrained in sternal or lateral recumbency. In this instance, the dog is restrained in sternal recumbency for utilization of the cephalic vein of the right foreleg. The assistant restrains the dog, paying particular attention to controlling the head. It's best if the assistant is positioned on the opposite side of the dog from the leg into which the catheter is being inserted. The assistant grabs the right foreleg at the elbow with the thumb positioned medial dorsal. While holding the leg in extension, the assistant rotates their hand laterally, occluding the vein so that it becomes visible on the dorsum of the leg. The individual placing the catheter should wash their hands prior to placing the catheter or use gloves if the catheter is going to be left in place for an extended period. The individual grasps the limb distal to the insertion site with their non-dominant hand, tensing the skin distally in order to fix the vein in position. Appropriate placement of the non-dominant hand in this position will facilitate advancement of the catheter into the vein. The catheter is held by the dominant hand using the transparent portion that is a component of the stylet. This allows for rapid visualization of blood when venous access is accomplished. The skin is penetrated at a relatively steep angle, and the catheter is advanced into the vein until blood flashes back into the transparent hub of the stylet. The angle of the catheter is reduced and advanced slightly. Blood should continue to flow into the transparent stylet hub. The stylet hub should be transferred to the thumb and index finger of the non-dominant hand that was previously positioned. Care must be taken to minimize movement of the catheter during this transition. This is a point in the procedure when novices have difficulty keeping the catheter from backing out of the vein. Keeping forward pressure on the stylet will help to prevent this. The catheter is advanced retrograde into the vein in one motion using the thumb and index finger of the dominant hand. The stylet is removed and T-port or solution administration set is attached. The fluid rate adjustment dial is fully opened, and the IV fluid bag is lowered below the level of the heart to ensure the catheter is securely positioned within the lumen of the vein and blood flow is adequate. The fluid drip rate is appropriately adjusted. The catheter is secured in the vein using 3 pieces of tape. Use one of the previously readied pieces of 1/2 inch tape initially. Encircle the catheter hub with one end of the tape and continue around the limb. Firm tension should be used to securely fix the catheter but not occlude the vein. Tear a notch 1 inch from the end of the piece of 1 inch diameter tape and slide it underneath the catheter hub. Continue the tape around the limb to cover the point of insertion and tape firmly. The second piece of 1/2 inch tape is placed sticky side up between the T-port and the skin midway on its length. Then both ends of the tape are crossed over the T-port and circled around the limb, providing additional security.